If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, can diabetes be curable without medicine? Answer by Tim Cochran. Some earlier moron wrote that it was not a disease but rather a body's coping mechanism. Blah blah blah, bullshit bullshit bullshit. It is a disease. It is a disease whereby the pancreas doesn't function, or it doesn't function properly to the point of supplying the required levels of insulin in order to break down the nutrients into the base components of which glucose, sucrose, etc. various sugars are formed as the body runs on sugar. The difference is the types of sugar. Refined or white table sugar is like poison to everybody, but most especially diabetics. I am a diabetic. I have type 2 diabetes. I have had diabetes now almost 10 years. My latest A1C was 6.6. It has slowly moved down, starting at 7.1 24 months ago, and has remained low and dropping ever since. I finally came clean to my doctor just prior to Christmas this year. I have been following the regimen set out by Dr. Irving Weissman of Stanford University. If you Google him, you will find him, or you can Google diabetes cure. If it does not mention Dr. Weissman by name, it is not the correct Irving Weissman. I do not condone anybody stopping their medication at any time. I still continue to take my medication as directed. I do subscribe to following the dietary requirements and caloric intake suggested by the study done by Dr. Weissman. In Canada, basically anything below 6.5 is considered not diabetic. That is my goal. Even if I have to continue on the medication, I'm still happy with the results. I look better, I feel better, I know there's less risk for cardiovascular events as well as loss of limb or eyesight. The loss of a limb would be absolutely devastating. However, I believe a loss of my eyesight would be enough to put me over that edge. To never see the sunrise or set, to never see the smile of a beautiful woman. It would be hard to adjust. I don't know if I could. That being said, please read it again and then again and then again, and then just to make sure, read it again before you consider even the possibility of maybe thinking about doing this. It took me almost a year of preparation before I started. I just wanted to make sure I totally understood everything that was involved and how life-altering it was going to be. It was and is life-changing. However, my numbers speak for themselves. My blood pressure is way down, everything is where it should be or better. It definitely comes with an incredible amount of dedication, in order for it to work effectively and properly. As with most things in life, you get out what you put in. Best of luck to you, and please pass this information along regarding this remarkable doctor and his groundbreaking research into restarting the pancreas. Answer by Shakyamuni Buddha. Absolutely. In Vietnam, we found a new treatment for diabetes called Curable. It is straightforward but extremely effective. Curable is a method that does not prohibit people with diabetes from eating much starch. Patients can eat how much starch they desire, but with boiled vegetable and soybean sauce only. When not under the threats from the protein, fat, alcohol, etc. mentioned above, the pancreas will recover. Boiled vegetables, especially boiled water spinach, can help the pancreas improve very quickly. For additional information, please go to We found a new treatment for diabetes, Buddha Everywhere Medium. Answer by Megan Follick. If you have type 1 diabetes, you must take daily insulin injections to keep your blood glucose in a normal range. Your body produces little or no insulin. Insulin is a vital hormone that helps your body convert food into energy. Without insulin, you would die. Source: in 3 weeks, 71% type 2 diabetics were taken off medication. If you have type 2 diabetes, the answer to this question is much less clear. Many people can keep their blood glucose in a healthy range without medications, either oral diabetes medications or insulin injections, if they lose weight and keep their weight down, are regularly physically active, and follow a meal plan that helps them keep portion sizes under control and helps them spread the amount of carbohydrate they eat at each meal throughout the day. Eventually, however, many people with type 2 diabetes find that despite their best efforts, weight control, exercise and diet aren't enough to keep their blood glucose in a healthy range. This is not unusual. One theory is that some people's insulin-producing cells just get tired out from having to produce more and more insulin because their cells are resistant to the effects of insulin.